Labyrinthitis feels like you are on a fairground ride that you never wanted to get on in the first place, that you are whizzing round and round. It doesn't matter whether your eyes are open or whether your eyes are shut, you're still whizzing round and round. It makes you very nauseous, very dizzy, and you can't get off it.
Assalamualaikum warahmatullahi wabarakatuh. So today my group would like to present about an infection disease which is labyrinthitis. So what is labyrinthitis? It is an inflammation of the labyrinth in the inner ear. Most people recover fully from that disease, but for some people it may take longer than others. Some people also may develop permanent hearing loss, especially common in the children who have bacterial meningitis that turns into labyrinthitis. If the hearing loss occur, the chance of it recovering depends to some extent on how much loss the individual have. The worse the loss, the more likely that there will not be any recovery or that only partial recovery will occur. But there are many options that can help patients to cope with any long-term hearing loss. In this picture, we can see that labyrinth located in the inner ear. The inner ear consists of two structures which are bony labyrinth and membranous labyrinth. For the bony labyrinth, it is a collection of bony cavities within the skull's temporal bone which consists of three main parts. The first one is the vestibule, cochlea and three semicircular canals. In the cochlea, there is a system of narrow fluid-filled channel called the labyrinth. The semicircular canal sense the movement of our head and help to control the balance and posture. The semicircular canal are connected to a larger fluid-filled chamber called the vestibule, which in turn is connected to the fluid-filled canal in the cochlea. So when we move our head, there is a sense of movement because when we move our head, the fluid in the labyrinth within the semicircular canal will move too. So this movement of the fluid will move the tiny fine hair that are lining inside of the labyrinth. When the hair move, this will trigger the nerve message to be sent to the brain via a nerve that called as a vestibular nerve. So this will give our brain an information about the movement and position of our head. However, a properly working labyrinth in each ear also needed for a good sense of posture and balance. Next, there are some signs and symptoms that patients with labyrinthitis may experience. So for the first one is nausea, vomiting, and severe room spinning. A feeling of spinning, or we call as vertigo, are the most common symptoms of labyrinthitis. So the patient may also experience loss of balance or blurry vision. For the initial vertigo rarely lasts longer than 72 hours. However, balance issue and occasional brief episode of vertigo may persist for several weeks, and the patient may also complain of hearing loss or tinnitus that clinically differentiate between labyrinthitis and vestibular neuritis, where labyrinthitis is typically associated with hearing difficulty and tinnitus, but for the vestibular neuritis is typically not associated with the hearing problem.
Okay, now I will explain about the causes of the labyrinthitis. The exact causes are not known, although labyrinthitis is thought to be most often caused by a viral infection. The infection may occur at the same time as or just after a common viral illnesses such as a sore throat, flu, or a cold. The infection can spread from the chest, nose, mouth, and airways to the inner ear. Now, upper respiratory tract infection also can attribute to the main causes of the labyrinthitis, while cytomegalovirus and maternal rubella is a causes to congenital labyrinthitis. Very occasionally, labyrinthitis may be caused by a viral bacterial infection in the middle ear and spread to the inner ear. It is more likely to affect young children and can be serious. There are two types of bacterial infection, which are toxic labyrinthitis and suppurative labyrinthitis. Toxic labyrinthitis is the result of steroid inflammation of the inner ear following an acute or chronic otitis media or early bacterial meningitis, while suppurative labyrinthitis is the direct infection of the inner ear by bacteria. Now, infection usually occurs by one of these three routes. which is the first one is meninges. It is through the internal auditory canal and cochlear aqueduct. The second one is the middle ear space, which is the extension of the infection from the middle ear, mastoid cell or Petris apex, which is most common through the round and oval window. The third one is the hematogenous spread, which is through blood, and this is the least common route of infection. Okay, labyrinthitis affects 35 million people per year, which is approximately 3.5 cases per 100,000 people. It typically occurs in those between 30 to 60 years of age, and there are no significant differences between male and female incident rates. In 95% of cases, sufferers experience a single attack and fully recover. Now, labyrinthitis is diagnosed based on the symptoms, medical history, and physical examination. From medical history, the patient may have severe vertigo, recent upper respiratory tract infection, and unilateral or bilateral hearing loss, while from the physical examination, the physician may check for spontaneous nystagmus, which is the involuntary repetitive eye movement, and purulent discharge. Now, as for the treatment of labyrinthitis, it must be tailored to the etiology and symptoms. Viral labyrinthitis should principally be managed by hydration and bed rest. However, patients must be counseled to seek further medical help if their symptoms worsen or they experience any neurological disturbance. In bacterial labyrinthitis, antibiotic type and route depend on the source. Oral antibiotics are the first-line treatment for acute otitis media with an intact septic membrane. However, intravenous antibiotics may be necessary if the infection fails to respond. Surgical intervention is only required in a minority of cases, for example, mastoidectomy in patients with cholesteatoma or severe mastoiditis. Occasionally, patients may require drainage of effusion or myringotomy in labyrinthitis, secondary to otitis media.
There are actually 6 chains of infection contributed to labyrinthitis. Firstly, portal of entry. Pathogens often enter the body of the host through the same route they exited the reservoir. For example, airborne pathogens from one person's sneeze can actually enter through the nose of another person. The skin normally serves as a barrier to infection. However, any break in the skin, intentional or unintentional, invites the entrance of pathogens. So for percutaneous injury, surgical incision, vascular access, and use of invasive devices all afford a portal of entry. So for viral infection, the infection can spread from the chest, nose, mouth, and airways to the labyrinth. In case of bacteria, it can enter the labyrinth if the thin membranes, which is the thin layer separating your middle ear from your inner ear, are broken. This can happen if you have a middle ear infection or an infection of the brain lining, or we call it as meningitis. Next, the susceptible host could be anyone of all ages, but most common is in adult aged 30 to 60 years old. In terms of gender, assigned female at birth, AFAB, more susceptible compared to assigned male at birth, AMAB. Next, immunocompromised populations and anti-vaccines are also at high risk.
So the third chain of infection is infectious agent. So a wealth of epidemiology evidence indicates a number of viruses as potentially causing inflammation of the labyrinth. So viral labyrinthitis is often preceded by an upper respiratory tract infection. The most common cause of labyrinthitis is a viral infection, such as from a cold or the flu, or infection with the virus from the herpes group of viruses such as cytomegalovirus and mumps virus, which causes chickenpox, shingles, or cold sores, as well as measles or glandular fever. And sometimes it is started from a middle ear infection or otitis media. The middle ear is the part of the ear just behind the eardrum, connected to the throat by a short tube known as eustachian tube. So when we have a cold, the infection can spread up to this tube to the middle ear. And middle ear infections are especially common in babies and children because of their eustachian tube are small. And other potential bacterial causes of labyrinthitis are Streptococcus pneumoniae and Haemophilus influenzae. The fourth chain of infection is reservoir. The reservoir is a host of which allows the pathogen to live, possibly grow, and multiply. So the deep structure inside the ear, called labyrinth, serves as a host to the viral infection and causes it to become inflamed. So inflammation of the perilymphatic space results in secondary changes within the membranous labyrinth, the most common symptoms of which are sensory nerve loss and typo. So labyrinth can also be involved by congenital infection such as cytomegalovirus, rubella, and syphilis. So an infectious or inflammatory process within the labyrinth can take two forms pathologically. One is serous or sporadic. So serous labyrinthitis is defined as an abnormal process within the labyrinth caused by bacterial toxins or contaminations of perilymph with blood, products, or tissue injury, or air surgery. So bacterial toxins may enter the inner ear during the course of acute or chronic otitis media, presumably through either the oval or round window membrane. So the next chain of infection is the portal of exit. So the germ way out of the infected person is usually the same pathway from the entry. Labyrinthitis is often associated with respiratory infection such as cold and flu. So the most common way out is through the nose and mouth from sneezing and coughing, and it can also find its way out through vomiting. And lastly is mode of transmission. Labyrinthitis is not contagious. That means it cannot be transmitted directly from an infected person, but some can catch infections such as cold and flu from someone else that then can trigger viral labyrinthitis. But in patients with meningitis, bacteria can spread from cerebrospinal fluid to the membranous labyrinth by way of internal auditory canal or cochlear aqueduct. Meanwhile, bacterial infections of middle ear or mastoid most commonly spread to the labyrinth through dehiscent horizontal semicircular canal.
Therefore, there are ways to break the chain. Firstly, to take vaccine. As labyrinthitis is caused by either viral or bacterial infection, one of the ways to break the chain of this disease are to take vaccines. Vaccines trains the body's immune system so that it can fight a disease that it has not come into contact with before. It has been demonstrated that maternal rubella infection attribute to the most common causes of labyrinthitis-induced congenital deafness. Estimates also show that the main cause of hearing loss within the postnatal period include measles and mumps infections. On the other hand, herpes zoster oticus or Ramsay-Hunt syndrome is also an infection to the labyrinth that is caused by reactivation of the latent infection by the varicella zoster virus, usually years since the primary infection was first detected. So evidence indicates that the main presentation of such infection can be mainly observed as a vesicular rash alongside the ear and oral mucosa, in addition to a classical paralysis of the peripheral facial nerve. Therefore, taking measles, mumps, and rubella, which is MMR, and shingles vaccines help to prevent the complications caused by these diseases. So another way to break the chain that could contribute to labyrinthitis is to practice infection control by taking care of personal hygiene in a public space. So for example, washing hands and wear face masks in public to protect us from environmental pathogens that can possibly enter our body and cause upper respiratory tract infection, which is actually the most common cause of labyrinthitis. So that's all from us. Thank you.